Good afternoon, everyone, and welcome to CDOC's quarterly Cancer Centers Collaborative Meeting. My name is Sheila Stenyo Gerhardt, she, her, and I'm the Strategic Alignment Specialist for the Comp Cancer Program and the California Cancer Registry. Since it's already January 2027, this may be the first time some of us are connecting in the new year, so happy 2026. While we are giving others time to settle in, please feel free to share your name, pronouns, organization, and something you look forward to in 2026. So I'll go over some housekeeping while everyone is typing in their introductions. All participants have been muted, but we encourage engagement and participation throughout this session. While the chat is being monitored for questions, we'll also have an open discussion allotted after the presentation. We hope you can also assist us with a short webinar evaluation, and the slide deck, recording, or any follow-up will be sent out via email to everyone in our listserv. Cancer Centers listserv. So thank you so much for taking the time out of your busy schedules to be here today. Joining us are Cancer Center Community Outreach and Engagement leads and program representatives, CDOC leadership and other partners, American Cancer Society partners, and CDOC work group chairs. Before we start with the agenda and presentations, I'd like to acknowledge our CDOC chair, Dr. Sara Tanjusiri from the University of California, Irvine, and co-chair, Dr. Allison Herman from UCLA Johnson Comprehensive Cancer Center. I believe Sara is here on the call. Go ahead, Sara.
Hi, yes, thank you, Sheila. Hi, everyone, and welcome to our quarterly Cancer Center meeting. I just wanted to say how lovely it is to see everyone. I maybe can speak for many of us to say it's not just that we're in an unprecedented time, but just a truly, truly challenging time in cancer research, health disparities, and cancer care. And so I just want to say how grateful I am for all of you for coming together in the spirit of collaboration and sharing to support each other, because I, for one, need all of your support, your forward thinking, your identification of opportunities to continue this work forward, because it's not only challenging, but there are lives on the line. And I cannot think of a more important group than folks who are committed to community engagement, to cancer, to quality cancer care, and to access for all, as all of you. So thank you, thank you, thank you for from the bottom of my heart for being here and for continuing the work and the charge that we all have.
Thank you.
Allison, I'm sure you'll have some beautiful words for us.
Well, I mean, I echo what you have to say, Sora. It feels good to be around people who are, similarly dedicated to the same goals and objectives and also supporting one another, regardless of what happens. So, these days I'm feeling a little hopeful, even though I'm like really, I don't know, scared, mad, and all kinds of things. But some of you might know that I lived in Minneapolis for a long time. Um, Now I guess I'm going to start to cry, but I feel so freaking proud of those people in Minnesota. And so I think that is a huge example to all of us how like we can support one another and we can do really important things. So yeah, so I didn't realize I was feeling so emotional, but I guess I am. Thanks you all for being here. And yeah, I look forward to what we can do together in 2026 to support all of the diverse communities across California. We really need to keep doing this work.
Thank you so much, Sara and Allison. Very well said. I'll go over the agenda briefly. We'll hear some updates from ACS, Comp Cancer Control Program updates, including the Cancer Plan revision item, followed by a presentation from the University of California, Davis. We'll also provide opportunities for discussion and collaboration, and we'll also have a chance to share and learn about other cancer centers events, research, and other updates, followed by a quick wrap up. To provide American Cancer Society updates, let me introduce our ACS partner, Bridget Freely, CDOC Vice Chair and ACS Associate Director, leading state partnerships in California.
Thank you so much, Sheila, and Allison and Zora. Thank you so much for your words. It's so important. And thank you for sharing. We just have my colleague Sam and I just have a few updates from the American Cancer Society. And Samantha, I think you're going to kick us off.
Yeah. No, thank you. Thank you so much, guys. It's great to be with you all today. And yeah, thank you, Allison, and Sora for those really humbling and felt words. It's been a minute since I've been on this call with all of you. Scheduling is very troublesome, and for those who know, I cover the state of California, but also Southern Nevada and the state of Arizona as well too. My team are those lovely individuals that work directly with many of you guys. So I always get so excited when I get to see familiar faces and get to interact with those in the communities. Now that I'm in a leadership role, I don't get to do a lot of the hands-on work. So really great to be a part of this group today and co-present with Bridget, which is also so great. So next slide, please. So before Bridget shares some really exciting updates, I did just want to share with you all some really great professional educational opportunities. On this slide, you will see our ACS Project Echo learning opportunities that are both for primary care and cancer care clinicians. Echo programs are really not webinars for those who have not participated in them. They're really thoughtful virtual learning communities built on the Project Echo model, which really uses the case-based peer-to-peer learning environment to really move those best practices into real-world care. So what that means in practice really is that those community clinicians bring real cases really into this unique multidisciplinary group of cancer experts and peers, and this really great community work together and walk through those evidence-based recommendations and referral pathways and care coordination to really help build local capacity so more patients get the right care in the right place and at the right time. So for cancer centers and you all, this is really special, powerful. So really, Echo allows you all to extend your expertise beyond your walls and really work within an expertise network across the nation. So all of our ACS Echo programs are free, nationally available, and designed to reduce really disparities and improve outcomes across the cancer continuum. We would love for you guys all to participate, whether that's referring clinicians or affiliated practices or care teams. Really take advantage of these programs. This is what we have dialed in for most of winter. There'll be more to come, and we'll share those updates as they're released. And with that, I'll turn it over to Bridget.
Thank you so much, Samantha. And we can go to the next slide. This is hot off the press, actually. This is our newest cancer facts and figures report for 2026 that was just released. For those of you that don't know, this report is released every year, and it's an annual report that is put together by our American Cancer Society research team with just predicted trends for the year. And just some big takeaways I wanted to highlight. We're finding about 70% of people diagnosed with cancer now survive at least 5 years. Nearly 5 million lives have been saved due to declining cancer death rates since they reached their peak in the early 90s. So we're really seeing a shift from cancer as at one point that was seen almost as a death sentence to something people can live with and live past. I do want to say there is a but. So while this progress is encouraging, we are still finding that rates are still increasing for several common cancers. And I think it really underscores the need for continued efforts in screening and prevention. You can access the full report down here. There's a QR code, and also these little red boxes are actually buttons that you can click. It will bring you to the full report, and also just some additional resources such as a PowerPoint, like breakdowns of the data, infographics, our press release, and more. We can go to the next slide. American Cancer Society's National Breast Cancer Roundtable developed a breast cancer risk assessment toolkit to help support providers. It includes evidence-based risk assessment tools, workflow planning resources, and also patient and communication and education materials, really to help identify patients at risk for breast cancer. One of the findings from our Cancer Facts and Figures report I just mentioned is rising rates in breast cancer. So this is a very timely and critical toolkit. And you can access the toolkit at this QR code or at the link that will take you to the Roundtable's website. We go to the next slide. The American Cancer Society also recently updated our cervical cancer screening guidelines. And I know we're at the end of January, but January is also Cervical Cancer Awareness Month. So this is very timely. I know this is a busy slide, so I'm not going to go through each line, but kind of a summary of the updates include guidance on HPV self-collection, as this is a newer option for cervical cancer screening, and also just clear recommendations on when cervical cancer screening can stop. Additional details are available on our website and through the linked flyer below. And I did have one quick update related to ACS CAN. I just wanted to share from our CDOC lung cancer screening work group. This is an effort from CDOC, ACS, and key stakeholders from around the state to improve lung cancer screening rates in California. Robert Park from ACS CAN, who couldn't be on the call today, but I know will join future calls, and Kisa Bruce from the American Lung Association, who sit on the CDOC lung cancer screening work group, have been leading a legislative effort to address cost sharing for follow-up testing for lung cancer screening, and essentially to increase access to lung cancer screening care. And I am really excited that we finally have an author for this legislative effort. Exact language and next steps are being worked out, but we'll definitely keep you posted as this advances. But thank you so much. And Sheila, I can pass it back to you.
Richard, I see a question on the chat from Sora. Is the ACS still aggregating Asian Americans and Native Hawaiians and Pacific Islanders? Do you know why this continues by ACS?
That is a great question, Sora. I can definitely reach out to our research team to get some more information on that.
Thanks. I mean, and this is in particularly in light of the fact that ACS published last year their Cancer Facts and Figures for Native Hawaiians Pacific Islanders, and I thought this sort of signaled a change, and a recognition of the need to disaggregate. So I'm just a little worried that we might be going a step back when ACS clearly has the opportunity to be able to disaggregate.
That's a great question, and I think it's some more insight into the future of hopefully that they'll continue in the path that they had last year, where they had that report where it broke everybody out. Absolutely.
Thank you so much, Sara and Bridget. Thank you, Bridget and Samantha. And by the way, Samantha Rustiger is the Senior Director leading Cancer Center Partnerships with ACS in California. Here is an overview of all the Comp Cancer Program and CDOC updates, and we will be sharing in the next 15 minutes or so. First, I'd like to call on our Program Director, Shante, to provide some state cancer plan updates.
Well, hello and Happy New Year to everyone. So I'm going to provide some updates on our state cancer plan. As you know, we have finished the 5th iteration of California State Cancer Plan, and this year we're doing a 10-year plan, 2026, or this year. For this iteration of the plan, it is a 10-year plan, 2026 through 2035. It is still currently in the CDPH approval process, so we're hoping for approval any day on that. In the meantime, we have assembled a committee called the State Cancer Plan Revision, or it's called the State Cancer Plan Implementation Committee. Thank you. And there's so many different committees and names and stuff. They've been meeting regularly to finalize implementation guides for the 2035 State Cancer Plan. These guides are designed as a helpful companion to the first 10-year State Cancer Plan, and they're going to be tailored for different audiences to make implementation of the plan practical and actionable. We've been coordinating closely with the CDPH communication team to ensure clear messaging and effective dissemination when the plan is approved and released. And we're grateful to have some of our CDOC members actively serving on this committee. So thank you all, because I know some of you are on this call here who have been helping to work to put these implementation guides together. And what you see here on the screen is an example of one of the guides that's going to be directed to local health departments. All right, and now I think I'm going to turn it over back over to Sheila. Thank you.
Thanks, Shante. And go ahead, Joyce. You can start your CDOC updates.
Thank you, Sheila and Shante. So just the next couple slides are just standing reminders for the CDOC Coalition. So the first one here is we hosted our CDOC orientation webinar on May 29th. And this was just an opportunity for new and existing members to connect in our coalition. We introduced a dedicated section of the CDOC monthly newsletter to remind members about the different levels of engagement, how they can be involved, and to improve their understanding of coalition participation options and provide essential information about the CDOC structure, focus areas, and activities. You can view the recording of the webinar on our website, and I'll be dropping the link to the recording in the chat. This next one is all members meeting recording. We just wanted to remind folks that we hosted a webinar on October 21st, and these meetings are annual and they're used to keep members engaged in the CDOC activities and provide a platform for sharing information across the coalition. This is just an opportunity to reconnect with fellow CDOC members and to stay aligned on our collective goal, and I'll be dropping the link to that recording in the chat. Next, I want to highlight the CDOC member spotlight. We just want to remind everyone that CDOC welcomes all partners that are doing notable work in cancer control. So your work as CDOC members is important to achieving our shared mission of reducing cancer suffering and mortality across the state. So we encourage you all to share what you're working on, and I'll be dropping a link in the chat if you'd like to share your projects or highlight maybe a colleague's work. Next, I wanted to highlight our Partner in Focus. It's a quarterly feature launched by us to spotlight one member. And so the goal is to kind of foster connection and collaboration and just inspiration across the CDOC community. So this quarter, I wanted to highlight Anna Knight. She is an active member in the CDOC Health Equity Work Group, and she's part of the Indian Health Service. So shout out to Anna Knight. And I will pass it back over to Sheila.
To start off with work group updates, I'll have Shante report on the HPV vaccination.
Thank you, Sheila. So the California HPV Vaccination Roundtable is a sister coalition of CDOC. It is co-founded and coordinated by CDOC. One of the activities of the roundtable I wanted to highlight is our California HPV Vaccination Learning Collaborative. This is a quarterly lunch series that happens the third Wednesday of each quarterly month at noon. We have already started our series, and we just finished our first session last week. But our next one will be April 15th. And we're always looking for presenters for this collaborative. So if you have any best practices you'd like to share to increase HPV vaccination, please contact me. I'll have Joyce drop the registration link for all of the collaborative dates there in the chat. So we encourage and invite all participants to share any efforts to improve HPV vaccination, like I said. And you can find more information about the Learning Collaborative as well as past recordings on our website. And there is the website in the chat as well as the link to register for the collaborative. The announcement approach training. This is another this is a training offered by the Engaging Health Systems and Engaging Health Systems and Providers work group of the roundtable. It's an evidence-based approach to increasing HPV vaccination endorsed by the National Cancer Institute. You can learn strategies for recommending HPV vaccination to promote vaccine acceptance and save clinical time. We still have CME credits, but we probably will not have them after February. But these trainings are held free. They're online. So again, contact me if you're interested in scheduling a training for your health system. And another project of Comp Cancer is the breast and colorectal cancer screening implementation project. Right now, we're in cycle 4. Our cycle 3 projects actually concluded at the end of December, and our cycle 4 projects started in January. We haven't announced all of the clinics. They're not up on our website yet, but we will soon. But if you want to see any of the past projects, you can go on the California Colorectal Cancer Coalition's website. They are one of the main partners in this collaboration, along with the Every Woman Counts program. And just for those who aren't familiar with the BSIP program, we have an RFA out every year to EWC providers who can propose projects to increase their breast and colorectal cancer screening by implementing evidence-based interventions. All right, in our CDOC colorectal cancer work group, we're very, very pleased to have presented Advancing Cancer Screening in California Data Guidelines and Health Plan Innovations. This was a educational webinar that was a long time in the making, a collaboration with Department of Healthcare Services, CDPH, the California Colorectal Cancer Coalition, and the American Cancer Society. We were working with the DHCS Medi-Cal Quality Division to bring this webinar to the Medi-Cal Managed Care Plans. The presentation highlights included data presentations on cancer incidence, mortality, and screening trends, updates on colorectal, breast, cervical, lung, and prostate cancer screenings, covering new guidelines, emerging tests, outreach strategies for underserved populations, policy shifts, and real-world success stories from FQHCs. We also had health plans on that provided some presentations there. And if you didn't get a chance to attend, it was recorded, so there's the link there in the chat. And one thing that came out of this particular effort is the Colorectal Cancer Screening Quality Improvement Network that will be started coming in April or sometime, and we'll go over a little bit more of that in the presentation. And here it is. So our colorectal cancer screening quality improvement initiative, it's a QI initiative being launched with health plans as the primary participants. And the collaboration will focus on aligning outreach and referral efforts and supporting screening and follow-up activities with partner plans and providers. So yes, we are proposing a launch in April 2026. And we're presenting it here at the Cancer Centers Collaborative because we know that you all work with health plans, FQHCs on colorectal cancer screening. So we may at some point reach out to all of our cancer center partners for a potential webinar within this series. So this initiative will include presenting educational webinars, and we'll bring in health plans, and there's a lot more to it than just webinars. But we're still building this initiative out, and we'll have more information on this in the coming weeks. But again, we're hoping to partner with some of you cancer centers as we start to develop what some of these webinars will entail. All right. And also from the colorectal cancer work group, because Colorectal Cancer Awareness Month is coming up soon. One of some of our members in our colorectal cancer work group have started a Colorectal Cancer Awareness Month toolkit. The tool, and again, this is a statewide uh, toolkit to support coordinated outreach and activities. So the toolkit will highlight activities and campaigns happening across the state, and it will serve as a shared resource that organizations can contribute to and adapt. So our call to action on this call for this particular toolkit is to invite you to share any of your planned Colorectal Cancer Awareness Month activities and also any campaigns, events, or materials you are using or developing. So I believe we're going to share this on this call. But again, the idea is that we just want everyone to be aware of all of the awareness month activities that are going on, as well as add to it so we can all kind of be on the same page and help with any other or help with any activities that are listed in this toolkit.
Thank you, Shante. So the Health Access and Disparities Work Group, formerly Health Equity Work Group, continues progress on its multi-year project focusing on underrepresented data in cancer research and care. So this is a continued collaboration with some of our NCI designated and COC cancer centers, the Cancer Registry, and other partners, and its aim is ensuring the data health equity. So just a note again that the project is no longer under the CDOC facilitated umbrella due to federal policy alignment issues, but the project's aim is to understand what types of demographic and identity data, such as race, ethnicity, sexual orientation, gender identity, age, and income, are being collected by cancer centers and to identify gaps. So previously, only 60% of California NCI designated cancer centers were collecting SOGI data. And as of 2025, 100% have now the ability to collect the data. A patient survey and the data collection has been launched, and the provider clinician survey is also being revised. Moving on to the survivorship work group, the Psychosocial Support Project Award continues into fiscal year 2025-2026. The main effort of psychosocial support is to help individuals cope with emotional stress and maintain well-being during challenging situations. It focuses on connecting resources such as counseling, support networks, or community services. So one contract has been approved with the Cancer Support Community San Francisco, and their implementation is actually already underway through June 2026. So when we did our first check-in with them, we confirmed that the project is on track and expected to meet and expand psychosocial support for at least 100 cancer survivors by June 2026. We also have another project, which is the Caregiver Support Project that is still under contract review. The proposed project aims to provide evidence-based education, tools, and resources for cancer survivor caregivers to support their physical and mental health, creating a space for social connectedness. And once again, once the contract is executed, we will also share more details about this project. The next project of the survivorship work group, and we have an action item or call to action as part of this initiative to our cancer center partners, is the CDOC Community Health Worker Guidance Initiative. So this work started late last year, and our work group leads, along with colleagues from City of Hope, have been sharing their expertise to shape this guidance document. So we've included it in our CDC work plan as well. And because there were some challenges, and we moved from developing a new CHW training curricula to creating a more comprehensive guidance document instead. So our approach was to identify existing standardized CHW or navigator curricula and build from there. The guidance consolidated and established resources, and it's designed to enhance CHW capacity and align with state initiatives such as CalAIM for sustainable cancer care support. So this guidance provides a modular framework developed by CDOC to support CHWs and related roles in cancer prevention, research engagement, and survivorship care. Again, so the document hopefully will be adopted by cancer centers, and it will also be shared with the Department of Healthcare Access and Information and the DHCS for consideration as a resource to standardize CHW practices in cancer care in California. Uh, and then, yeah, so our main ask really is once this document is ready for dissemination, please sign on as a participating cancer center and join as an advisory committee to share more insight or strengthen this guidance and support also the implementation of the state cancer plan because we've included some strategies in the upcoming 10-year state cancer plan about CHW. We will also share the finalized CDOC CHW guidance initiative with HCI and DHCS for inclusion in their resources repository and shared amongst their listserv. Next slide. Before we move on to the Cancer Center host presentation, we're wondering if anybody has a question with regards to the many updates that we've just shared right now. Checking the chat.
Sheila, this is Kimlin. Thanks
Hi,
so much for presenting that. Just wanted to share a little bit on the last slide on the community health worker. We, recognize that community health workers are an effective, working within the communities to implement prevention and promote resources and access to care. But there's been a gap in terms of specialty care, and one of them being, cancer care. So this is intended to fill the gaps and create some additional training and opportunities to build capacity among community health workers to promote cancer prevention and control. That's it.
Thank you so much for clarifying that, Kimlin. All right, I don't see any other questions on the chat. All right. In today's presentation, we have the pleasure of hearing from Dr. Eliza Tong, a professor of internal medicine at UC Davis and the medical director of the Stop Tobacco program at the UC Davis Comprehensive Cancer Center. Over 10 years ago, she led the CDOC call to action for California Cancer Centers on Tobacco Cessation. She is part of this NCI Cancer Center Cessation Initiative and the Commission on Cancer's Just Ask and Beyond Ask Task Force, which has led to the new Smoking Cessation Standard 5.9. Please welcome Dr. Eliza Tong.
Thanks, Sheila. Can you hear me?
Yes, I can hear you.
Oh, great. Okay. Well, thanks, everyone. That was a lot of info. I was still processing all those announcements. Shifting gears to tobacco, and I think we have 25 minutes, or so. But want to make this interactive and have more time for discussion because this is kind of like remodeling your house, and there's always something to do, on tobacco. And I would love to hear from other folks what they've done. So super excited to announce after several years, the Commission on Cancer has released this new standard, which is, and if folks don't know what a Commission on Cancer is, it's accrediting body for a lot of our community cancer centers nationwide. Some people say 70% of cancer care, and they just released the standard 5.9 for smoking cessation for patients with cancer. So what I want to do today is kind of review what the standard is, like the highlights, even for me, I have to read it several times, even though we've been working on it. And then kind of talk around, what in California, who's doing what, and would love to hear from folks and discuss, what's going on or, what questions people have. And this is just the beginning, I think, for everyone. So next slide. Sheila mentioned the Just Ask and Beyond Ask projects, and I just put that here on the left. If you want to Google, Commission on Cancer, and then see what these projects were about. They have these beautiful websites, beautiful resources, and they were nationwide quality improvement projects that led to a couple articles, and I put the URLs down there below if the slides go out later. And Again, so let me back up a little bit. What is Commission on Cancer? It's under the American College of Surgeons and accredits cancer centers for meeting, quality standards for, when I first went to my first cancer committee meeting, I was like, what are we talking about? Like, I'm a medicine doctor, and I realized, oh, this is under surgeons, but, it is very comprehensive. There's a standard for genetic counseling. There's a standard for, psychosocial distress screening. So there are some, that it's thinking about not just counting how many lymph nodes, but what other programs support quality of care for cancer programs. So 2022 was this Just Ask project, and then 2020, and I think about over 750 cancer centers nationwide participated in it. And I think you also got a lot of credit for doing this project too. And it was a low bar, just show that you're asking about smoking. And I think the results of that, it showed, for the most part, the majority of folks reported that they were, but when you got to the part of how are you helping people with treating tobacco use, that's where I think less than half of the centers participating reported doing things. So that's why the 2023 Beyond Ask was focused more on let's now not just screen, but also assist the patients for tobacco treatment. And then how many cancer centers participated? Over 300 or so, most of them having done the Just Ask project. Not as many QI incentives, that you could check off for what COC wants every year, but great that so many folks participated. And I think you can look at the article, you can see that there's an improvement. I think over half of people, over the half of the cancer centers said that they started assisting more, quit line referrals. And we'll get into this. What is assistance? So that was great to see that things were moving in the right direction. And so from these two projects, I think it provided COC the feasibility data to say, okay, now let's move to a standard, because they have to do this for everybody, right? That everybody needs to, in specialty care, start screening and offering assistance. So this just started this calendar year, and you can read the full URLs down there. But just that highlighting that paragraph, that summary paragraph, you'll note that it focuses on cigarette smoking. Again, they kind of want to get something that everyone can do at a minimum. And then let me go forward with some of the highlights. So next slide. So for screening, what does this new standard say? Who is being targeted? And they say patients with newly diagnosed cancer. So, ideally it should be everybody who's a cancer patient, but for the purposes of the quality improvement and what you're reporting annually for Commission on Cancer, they want to know who is, when they first come to your cancer center, is the cancer center screening? And when is that happening? Initial patient encounter or consultation at the cancer center site. And I just put an asterisk there because there's some clarification that you don't just count that they had their primary care visit last week. You need to timestamp and review and confirm when they come to the cancer center. So for a lot of us in primary care, and I'm in general medicine, years ago when the electronic health records came out, there's a little timestamp also for, I reviewed in the electronic health record that this person is a current smoker. So that's that same idea that it needs to be reviewed at that initial encounter. And then how do you document smoking status? There's some guidance, but again, from meaningful use of the electronic health record, there's some standard definitions. So current, and there's clarification, that means the past 30 days, because that doesn't mean just today, which some patients in the hospital tell me, I see that they get marked as former smokers, and then I realize, they were feeling sick and just quit yesterday, right? But somebody documented former smoker. So current smoker is past 30 days, former never, and EHRs also, they do have passive exposure as well, but that goes beyond what the bare minimum for the standard is. So again, you can go above and beyond this minimum requirement of only addressing cigarette smoking, preferably. And then what we do in primary care also for our quality metrics is addressing tobacco use, which includes smokeless tobacco products, including oral nicotine pouches, vaping, so e-cigarettes, vaping nicotine. And then you can do it more frequently than the initial encounter. It's just what COC says is the bare minimum. And then lung cancer screening was mentioned earlier, but this is not a requirement for what we do in primary care yet, or specialty care. But you can look for eligibility, and ask about pack years and quit date, which would help you with lung cancer screening too. Next slide. So what tools do we have to help with screening this? So my California Quits project, which is funded by California Department of Public Health with the Tobacco Prevention Program. Our contract actually ends in June, but we have all these tools for clinic staff already online. So there's a toolkit that's available that works, that you can look for implementation tips and handouts there. And this is one handout that our team had made that just kind of, it can be used for the clinic staff to say, ask about these tobacco products. Here's some scripting, and brief advice, and then you can also refer. And I'll get into refer in a second. Next slide. So assistance and referral, what does the standard say? Who is it? So assistance for patients who report current smoking, so looking at that proportion of folks. What is it? Refer or receive access to evidence-based treatment by protocol. What is evidence-based treatment? I have a little asterisk going down. That includes behavioral counseling and pharmacotherapy. Behavioral counseling, we went back and forth on this in the Just Ask task force, and they don't, in primary care, brief advice counts, but they really would like something, since these are cancer patients, who we know if they stop their tobacco use, they'll have better cancer outcomes. These are, the sickest populations. They wanted things a little bit more intensive. So not just brief advice or pamphlet, but individual counseling documented and by tobacco treatment specialist or provider, referral to an on-site group or class, referral to a state quit line, and I bolded that because I'll talk about that in the next slide, or a community resource. So your county health department may have a class available. American Cancer Society has some things. Enrollment in a mobile health program like Smoke-Free Text. There's a ton of stuff out there online, but they want to go for something that's considered evidence-based. Prescription of FDA-approved smoking cessation medication, and I'll go over that in a little bit too. And now the key part is, one more thing on that slide is the key part is when, and do it within 30 days of the screening. So again, ideally before people start active treatment to get the optimal, cancer outcomes for their care. Next slide. So quit line. Some of you may or may not know, but our state quit line rebranded during the pandemic from 1-800-NO-BUTS or California Smokers Helpline to Kick It California, because the buffet of tobacco industry products now includes many different things, right? So those three categories I already mentioned. So if you don't already have an electronic referral in your electronic health record, what you can do is refer directly from their website. You can go to this web link and click that refer a patient. Doesn't have to be an MD, doesn't need insurance, and you can just tell patients, I'm going to have Kick It California give you a call in a couple days, and they will call. Anyways, it's very simple and easy. But not everybody wants to talk to somebody anymore, and just on the right is just the variety of other things that they have. They have an app, they have they have chat on their website, they have a texting program that's a text reminder program. So lots of great things. And by the way, they have now started coaching on cannabis as well for young people, 13 to 29 years of age. Next slide. So yeah, for pharmacotherapy, there's 7 medications that are approved by the Food and Drug Administration for smoking cessation. So, gone through all the rigorous trials. There's so much stuff out on the market right now. I've had a patient come and said, I got a nicotine lozenge at 6 milligrams from the market. And I'm like, I'm not sure that that's medication. I would, there are a lot of products out there now that call themselves lozenges. And so be careful. But I can give you a prescription that will get you, probably no cost medication. So anyways, there's more resources on this from our website as well. Medi-Cal covers it, and then Medicare is always sort of a weird thing in terms of maybe your Advantage plan, if it's an over-the-counter thing as well. So anyways, it's complicated, but we can talk more in the future about that. But varenicline, which is Chantix, is generic, so also low cost and very effective, considered first line. It doesn't have to be just nicotine medication. Next slide. Annual audit and action plan. So again, this is the last part of the standard. So what do we have to do annually as cancer centers? So minimum of 20 patients with newly diagnosed cancer. So pull your charts, get the number of patients screened, and then get 10 people who report current smokers as current smoking, and then look to see where did they receive or were referred to smoking cessation treatment. And then, I've had folks say, well, what if they declined? Well, that counts too, but how do you document that? Sometimes that's a little bit tricky in the electronic health record. And, hopefully they document it in the note. Ideally, it should be something in your EHR. So action plan. So it doesn't, this year is a measurement year. So you have to present and document these results of this audit at the cancer committee in the same year that it was done. And then if you didn't meet your goals of getting 90% of patients screened for smoking status, or 80% of patients who smoke being treated or referred, you just have to document, here's our action plan of what we're going to do for next year. Next slide. So how many cancer centers does this affect? When I go to their website of COC, there's over 100 cancer centers in California who are accredited by Commission on Cancer. So I just put the website link in there and took a screenshot of of all the dots that I could see. And there's some of the big systems here, and I think there's some who've joined us today. And how do we engage everybody? I'm just curious, what is everybody doing out there about this? So next slide. And some of the NCI designated cancer centers, we've been lucky to be part of the Moonshot Cancer Center Cessation Initiative, which started back in 2017, and there were 3 cohorts. And I know a number of folks on today are part of this. And so if you want to look at more resources from the C3I project, University of Wisconsin has been the coordinating center. So they have a ton of materials there also that also relate to Commission on Cancer. You can see what other cancer centers have done to implement tobacco screening and treatment. And then this is one of my favorite little handouts by NCI on the right that's patient friendly to say, why it's never too late to quit smoking, that you'll get better outcomes for your cancer treatments. Next slide. And then here are the folks who are part of the C3I initiative here in California. And so glad to see some of the folks on today. Next slide. And then just our website for what UC Davis has done. And we have a paper about how we collaborate with our primary care health education program on tobacco. So we have some internal referrals and then also the option to do quit line outreach as well. Like I said, it's like remodeling your home. There's always something to do or something that changes or something that needs fixing. So it's always a work in progress, but would love to hear what other people are doing. Next slide. And next steps, if you haven't heard of this, if this is your first time hearing about the standard, check with your cancer committee about what's being done to implement it. And then you can also check what other tobacco treatment resources are at your health system or with your county health department. There are those resources about implementation to look at. And then stay tuned. Thanks to Shantae and team for the letter of support, but we submitted a grant that for a California Quits Cancer Collaborative. So maybe we'll get to continue this sort of work and sharing what's going on maybe as soon as the summer. Oh, thanks. I don't know if we have time for discussion or questions. I see a couple things in the chat already.
Yes, we do, Dr. Tong. So, Shannon, would you like to share your questions? I can also read it off from the chat.
Oh, yeah. I just had a question about Kick It California and whether or not since the rebrand, they've reinstituted the LGBT specific cessation counselors.
Oh, hi, Shannon.
Hi.
Nice to see you. I know
You too.
you're such a champion. You'd have to ask them. I don't know. But I know that in the past, there was a lot of effort to train up their coaches. And I think that's so important, especially as they, branch out to, target, the youth and young adults and on cannabis. Like it's so, very diverse communities that they need to address. And yes.
Yeah, we had the entire Angels program, and I know they folded it when they first did the rebrand, and I haven't heard whether or not they reopened it, but I'm not a project director for projects that works directly with them anymore. So yeah, the other question I had was about if you know anything about Medi-Cal coverage and the over-the-counter nicotine replacement treatments, because we have had issues locally for my partner getting her funded access to the NRT over the counter, even when it's through a prescription, because the Walgreens here refuses to cover over the counter medications on a Medi-Cal card. And so we've been out of pocket for it, but it's expensive.
Yeah. Ooh, this sounds like a question for Robin Corelli, but maybe ping me on this because I would love to learn more about what's actually happening though. But it is a Medi-Cal covered benefit. So that was our flyer for California Quits, that it's on the formulary, it's a covered benefit, and then, that's something to point to anyway, is the formulary. Like, here it is, should be covered.
Yeah, it was really, I had a long conversation with the pharmacist there, and then we were like, no, it's fine. I'll just buy it. It'll be okay. But
I'm not sure if Sophia has some insight, because I know, Sophia, you're always frontline and helping with that. But
Hi, Dr. Tom and Shannon. So from our team's experience for Medi-Cal patient, sometimes we need to do a little bit of the navigation service for these patients. So when we prescribe the medication, like not over the counter, the nicotine replacement patches or gum lozenge, we especially with Medi or Medi-Cal folks, and then we will let them know that, hey, if you encounter any problem in a pharmacy, feel free to give us a call. And then sometimes we have to talk, like Shannon, what you did, talk to the pharmacist or talk to the person who prescribed. And we found out that for some of the brand, it's not covered. Like, for example, CVS, if they are giving the CVS brand and try to get the coverage, it's not going to cover. So we have to pull out the formulary list from the Medi-Cal program and then read them the code. There is certain code is being covered. So when they plug in the code, they sometimes have to order that. Like, I don't know about Walgreens, but like CVS, from my experience, the pharmacists have to order that particular code, particular brand, and then for the patients or some of the smaller pharmacy. So that is some of the work, maybe have to be done and handhold the tobacco users.
Okay. Yeah, thank you for that insight. I feel like this is going to be added to a lot of advocacy, because that's a pretty big hill to climb over, needing to be able to make a whole lot of calls when you're denied initially at a pharmacy. So especially for folks who are on Medi-Cal. Thank you.
Thank you, Shannon and Sophia. Dr. Tong, we also have a comment and a question from Jessica in the chat. I'd love to add the Kick It California personal free quit services cards to our packets if for new chemo patients? Are they available in soft copy so I can send to local FedEx for printing?
Oh yeah, if you go to the Kickit site, they have free download for things, all like health education materials. Or thank you, Shannon. She, um, so anyways, I don't know if it's the if you're specifically interested in the card or just a flyer, but Shannon just posted one of the flyers. But I know they have uh those little cards to give out to folks too.
Perfect.
And
Thank you.
Shannon, I don't remember if you can put in the chat, like, if Kickit still gives it for free, or if you ask your county health department, they can get you free stuff too.
Thank you, Shannon.
Sorry, county public health department. You can go to undo.org, and I know they have a connection there to find your county and tobacco public health department.
Thank you for
I'm just curious if anybody else is doing the Commission on Cancer standard implementation stuff now. Sophia and Kimlin, I know, and Brenda. I don't know if you guys, but no fair, you guys were already part of the C3I, the NCI C3I. But if anybody wants to share anything, would love to hear what's going on. Or even Sora.
Well,
hi, Sora.
Hi, Liza. Thank you. Thank you for spearheading this. I can remember when I started at our cancer center, what is it, like 8 years ago? And it was like pulling teeth trying to get them to do anything beyond, like printing out a piece of paper and giving it to a patient around smoking cessation. I don't know, but since we have to do the barriers to care standard and we always have to present every quarter, I'm going to ask and see, and I will report back to you but honestly, can I say this in this group? This is a friendly group. Our cancer center has been a laggard. So I am so happy that you're leading with both the stick and a little bit of the carrot. Thank you.
Yes. Well, I rationalize it to myself as this is American College of Surgeons. It's different than maybe at least for me, medicine, where that's kind of bread and butter to, give medications and counsel people. So it's a little different. I've just had to, yeah, at least for this accreditation purposes. But when it's a standard, everybody needs to pay attention. Yeah.
And
Anyone else want to share? And it's okay if there's like, I just like Sora said, not sure if anything is going on, and that's okay because this year is a measurement year. So everyone's probably like, oh, we can just deal with it later. But, there's too many fires.
And I see additional links and resources provided by Shannon, both Shannons on the chat. So thank you for posting that.
Thank you. Dr. Tan, since you're on the call, I'm wondering if you've heard about the coordinating center grant from California for tobacco. I'm wondering if anyone, like any of the health system, is applying for that grant.
Oh, that I don't know. I know the state tobacco program has less funds from the tobacco tax, and so there used to be are you referring to the priority population centers, and now there's an RFA for one coordinating center. So yeah, I'm not aware of the details of what's happening or who's applying. Well, would love to keep this conversation going. And, this is important work to help all the cancers in our cancer center. So would love to feel free to reach out to me, and I can put my email in the chat. I would love to keep the conversation going and learn from each other about how to help our patients. Thanks.
Thank you so much, Dr. Tong, for your clear and insightful presentation on Standard 5.9 and smoking cessation strategies. We really appreciate your leadership in advancing these efforts across cancer centers. With this, I'd like to open the floor for any cancer centers representative in the call who would like to share additional resources or updates before we move to a couple more items in the agenda.
Sheila, can I just highlight a comment that I made, which is I think we should do a partner highlight on Kick It if they qualify, and particularly the important leadership that Eliza and her team have taken to get this standard into national guidelines. I think that would be a wonderful highlight to tell. So thank you, Eliza, for agreeing to be spotlit.
Thank you, Sarah. And also, you could email us at CDOC any resources that you'd like us to share with other cancer centers if you don't have any other resources to share at the moment. All right, we can go to the next slide, Joyce. All right, so we've formally adopted the CDOC Cancer Center's collaborative engagement framework. This document will be shared widely in the coming weeks to align your participation as a cancer center and impact of your participation during this cancer center collaborative calls. So let's just backtrack a little bit. What is the Cancer Center's collaborative all about? It is a statewide network coordinated by CDOC to connect cancer centers, share resources, and amplify best practices, supporting the state cancer plan's goals around collaboration, equity, data sharing, and reducing disparities. So the framework explains why your participation matters. And first, it's a collective impact. Together, we tackle statewide challenges and improve outcomes. It is a space for resource exchange. When you are on our cancer center's roster, you'll have access and be able to share toolkits and presentations and projects within your colleagues. This collaborative it also gives you visibility and recognition. Here, you're able to showcase your cancer center's work statewide. And then this is also a platform to also this is also a professional community space where you can learn from your other peers. This group also helped advance, as I mentioned earlier, the state cancer plan goals. And the document will also show you how CDOC can support you. So you'll have learning opportunities from partners and peers and peers, and then you'll get regular updates and e-blasts with new resources. You'll get recognition for your active participation. We have this open feedback to keep improving the collaborative. More information will be coming out soon, and when it does, we ask you to kindly please help us update your cancer center representative in the roster, and share the names of others who you think should join these convenings. So the framework guidance will give us how to stay engaged, join the quarterly meetings. Again, we really appreciate your time because 4 meetings out of a year for 1.5 hours, we truly appreciate you sharing the space with us. And Shante, do you have any addition with regards to the engagement framework?
No, I think you explained it perfectly, Sheila.
Perfect. Do we have any questions? And yes, Eliza, we will share your slides. Thank you so much.
Actually, can I just ask, so we need to confirm our center's representative, we just need to email you?
I will be sharing a follow-up email providing you this engagement framework. And then with that email, we'll also verify all the representatives per cancer center.
Yeah, and if I can just follow up to say that everyone, we will be emailing that out to everyone.
And can I just underscore that we take a pretty broad definition of cancer centers. So, for example, it's not just NCI designated, right? So we should be sharing it with folks we know at different other cancer centers to try and grow this. Okay, thanks.
Thank you, Sarah. All right. For next slide, I'll pass it back to Shante for an opportunity for our cancer centers.
All right, so we wanted to share this new opportunity that we have, and honestly, we started this a while ago, and so some of you may have already heard it, and some of you may already be familiar with it, but yeah, we're gonna move forward with this. So this that you're seeing right now. Which one is this, Sheila?
Next slide, Joyce. Sorry.
Sorry, that was setting me up there. Okay, so we have the California Cancer Resource Hub. That was initially developed with extra funds to compile survivorship resources within the Comp Cancer program. And our survivorship work group spent over a year gathering these resources. So the project faced delays due to IT restrictions and contract issues that we had preventing further development and finalization of this resource hub. So basically, this resource hub was an online platform where it was built out by a contractor, but we still needed a little bit more improvements to make it usable. So we have this whole platform for this particular hub. It was built out, but like I said, we just need someone now to take over management and updates. So we have presented this to our health equity work group, and they might take on helping to build it out because they are looking for a new activity, which does align with our new cancer plan goals. So I guess we're just presenting this now to see if this could be that opportunity or that activity that we have to come together, just kind of utilizing this collaboration here. And to be honest, the main thing that we need is some funding to get it to where it's usable for folks. And so, and in terms of like how much funding that would be, I believe having them set up this initial online platform that we're going to share so everyone can see it was probably about 30 grand or so. So the additional updates to it, I don't think that it would cost that much. But one of the things we would have to work out is basically how will this be managed and updated if this is something that we wanted to kind of take on as a collaborative. And I want to point out that we were presenting it to the collaborative because we did see that there could be a need for the cancer centers and sharing resources through this platform. So that was one thing that was identified in our our 21 to 25 state cancer plan was the sharing of resources by cancer centers. So Sheila, can you present the hub now? We'll just kind of show what I'm talking about just so it makes a little bit more sense to folks. And please feel free to ask questions as we go if it's not clear, because I know for us this is kind of back of our hand, but for those who aren't understanding what I'm talking about here. So this is the California Cancer Resource Hub. And by the way, the company that developed this, we had to kind of put this to bed a couple of years ago, but we recently contacted them and they said, sure, we'll open it back up for you if you want. So just making note that the developers of this, if someone takes this on and decides to fund it and is looking for a contractor to finish it, the initial developers were great. And they even paid for us to host this for a year, although we weren't able to use it. So this is the hub. And if you go up really quick, we're not going to do a whole walkthrough, but there are different categories here where resources can live. And within each one, if you could just show survivorship really quick, Sheila. The main, or Joyce, the main point of this and why this would be different than just a regular website that houses resources is, can you go down these little collaboration buttons? So we have one where you would be able to connect with other cancer centers, other partners, depending on where you know which tab this was. So you can collaborate here. Then you can share, where you can upload all of your resources or anything you wanted to share with the cancer centers. And then, of course, there's a search function to find different resources, which would be like online resources for survivors, or other cancer prevention related resources that you could search for. And then there would be like a calendar and things like that. This one was built out a little bit more for survivorship, as I mentioned, because our survivorship work group was the one who started this and did a lot of work on it. But you know, moving forward, whoever would take it on could adjust it as they would like. But again, the main goal was to have a platform where we can not only share, but we can connect and collaborate. And again, for CDOC, because we're managed through the Department of Public Health, there were just too many restrictions on getting this approved as a contract, and a lot had to do with the the collaboration piece, where you know all of the security levels just wouldn't pass through CDPH because of all of the outside sharing. So is that clear to everyone? Does anyone have any questions, any ideas on this? Yes, Sora.
So if I'm correct in understanding, you're looking for both a home for the hub, or I'm not sure if that's the right term, a host
A
for the
host.
hub? Okay.
A host, yeah. And I think that, you know, our health equity work group could help update it, at least the health equity
Yeah.
pieces, or I'm sorry, the HAD work group.
Yeah. Yeah.
And you know, the comp cancer teams, CDOC could help manage it, but we would really have to figure out like what would work and what makes sense. But the biggest roadblock is that we can't continue building it out, and because of the CDPH restrictions.
So one of the things I think, so it's an interesting opportunity, obviously, to take on hosting something that has already been built out and already has, I think, a nice connections to, you know, obviously the state cancer plan and theoretically, at least to all of us, right? Depending on how many people are using it and wants to be populated in it. I think that there might be some technical questions we would need to figure out, like what platform is it on, and would any particular site who might be interested have the literal capability to keep it up? Like, do they have access to that platform or whatever software is used? Do we have personnel to be able to do it, et cetera? And the reason why I ask is because I remember several years ago, um, at least in Orange County, we were asked by the county to take on hosting a coalition, and that coalition had a beautiful website. The cancer center, my cancer center said yes, because you know we wanted to keep the coalition going. But then we realized then that there were just too many walls with what the county had developed, that we could not take it on. It was just impossible to take it over. And so we had to create something anew, which we did because we had agreed to, you know, to host the coalition. But so now I'm a little gun shy, like, oh, I would want, if there's any way to get some of the back end, like technically, what would a hosting site need to what, you know, the platform, the access, or whatever, to be able to do it? Then we could go to our IT people and see whether it's possible.
Well, I will say that the challenges we had with the department was moving forward with a second contract to continue developing it. It wasn't anything that was already on the platform. So what's on the platform is minimal. And if someone took it over to host it, you would have ownership of that and be able to move things around and put things in how you would want. So I don't think that would be a roadblock.
Okay, but I still think just confirming this would be helpful. because essentially part of the thing about sustaining this we would need our IT folks
Mm-hmm.
to be able to commit to it. And usually what they do is there's some sort of a user interface that they just give us the opportunity to go in and, edit or whatever. But they still need to confirm that it's a appropriate vendor, whatever it is for our university. There's just so many questions I didn't even know to ask. So is
Yeah.
there kind of a technical sheet around like what does this involve that you might want you can distribute to us
Yeah, I think we
what?
could get something from the contractor that developed it, because I think what you're talking about is they have all of that information. But yeah, we could definitely get that for
Mhm.
sure.
Yeah, that'd be great. And maybe a contact
Yeah.
person there. So if we have any follow-up. Because
Yeah.
again, we've done this at UCI. Um, and I think it falls under COE, at least, community outreach and engagement, some of the things that our goals are, right? So I think naturally, at least my university might be interested, but I'm sure they'll have a ton of questions. Okay.
Absolutely. We can get whatever you need. So thank you for raising that. And yeah, we'll start to get some of those together from the contractor.
And I don't want to exclude all of the people who are on here. I mean, I think there might be similar. I mean, would anyone else think that the university would at least be interested in considering this opportunity?
I was just wondering if since Shantae's at UC Davis, technically, like, is it going to
Oh,
have to be one of those weird things of, well, does that help? I don't know the barriers
it does
Sora's
not
talking
help.
about, but
Unfortunately, yeah, I know what you're talking about, but no, like I said, unfortunately, it doesn't help.
okay,
Yeah. I mean, well, I don't know. I don't think so, but maybe I can check into that actually. Yeah.
ask Ellen. I don't
Yeah,
know.
I'll ask all in. Yeah. Thank you.
Yeah, I'm also happy to ask about it for UCLA, but I don't feel super optimistic, unfortunately.
Well, if you can only ask, and so that would be much appreciated, because after it's been a couple of years, and after cancer plan revision, we're looking at this again, and it would be a shame to let it go to waste, especially because when we had started with the health equity, when we were the health equity group a couple of years ago, collecting resources for clinical trials, and we have a lot of resources on that front, and some other resources that were collected that we can still utilize. So yeah. Well, thank you, Sora, for bringing those points up. We'll definitely get something from the contractor and the developer's name is Asari, by the way. So we'll definitely look into that.
Well, and thank you for not only having been part of, putting all of this together, but then remembering and trying to keep this going.
Yeah.
Yeah.
But if this is something that can be revitalized and actually implemented, I really think all of us and all of the centers will really benefit from it, because it will be that central hub where we can, oh, on the cancer centers call, we mentioned this, it's going to be in the hub, and then if there are questions about it, there's that collaborate button, if that works out how we have imagined. So we'll
Well,
see.
honestly, Shantae, there are so many. I mean, this is a good example today. There are so many resources that we always share and we provide separate links to, but they
Yeah,
don't live anywhere. So
exactly.
if you don't grab the link and bookmark it or something, it's gone. And just trying to
Mhm.
find it is impossible. I mean, I'm thinking about like all the cancer, topic months, like colorectal cancer and all those.
Oh yeah,
Theoretically could live on this hub, and so we don't always have to be searching for it or, contacting you separately will you resend me that link?
yeah, for
So
sure.
I can totally see it.
Well, thank you all for that discussion. And yeah, we'll be following up on it.
Thank you, Shante. Thanks, Sora. All right. As a quick reminder, we'll maintain the quarterly format for collaborative meetings, and then all of the 2026 dates are shown on your screen. The Cancer Center hosts are identified alphabetically with the next host to be determined. But if you would like to present a project, please email me or anyone at CDOC. And please also complete the short webinar evaluation, which has been dropped in the chat. We will be emailing the slide deck, any follow-ups, and a lot of projects that we have mentioned during this call. The meeting recording as well, as soon as they are ready. Thank you again.
Sheila,
sorry,
Stoney has his
Stoney.
hand up here.
Just a quick,
Stoney.
I posted in the chat like everyone is, but this is a document that has a lot of the activities you can do to celebrate Colorectal Cancer Awareness Month. We want to make blue the new pink, and then it lists some events also. And so you can send to me or Shante or Sheila if you have an event that's not on there that you would like on that. We're trying to share this widely in the month of February so people will know what's happening, what you can do, and what is already planned for Colorectal Cancer Awareness Month. Okay.
Thank you,
Thank
Stoney.
you, Stoney.
I
Yeah.
see the PDF posted at around 1:18 on the chat. So anyone feel free to download that, and we'll also share that on our
Thank you very much.
Yes.
Thank you, Joyce, for redropping it. All right. Anybody else has some question? Shannon had a comment. If there isn't a single cancer center who can ask as host, if there can be a collaborative funding brought together, one of the Health Access and Disparities Work Group organization was interested in leading the actual work. They just don't want the funding to support the project.
They don't just have the
They
funding.
don't have
They just
the
don't have
funding.
sorry.
Yeah.
They just don't have the funding to support the project. Thanks.
So the executive director of Cheeky Charity was really interested in being able to put together the activities to support the continued development of the platform and sharing. So that's also an option that's out there, is if the Cancer Centers Collaborative could find a way to have a collaborative funding mechanism to build out and maintain the site. We have an organization who has already stepped forward with the interest in doing the work for it. And we would need to have a conversation and bring David in to see what that looks like on his end, and if there's staff support that would also need to be funded for it. But we do have that interest that was expressed.
Wow, that's nice.
Thank you for bringing that up, Shannon. Appreciate it.
You know, Shannon, another way maybe to look at it would be if they're interested and they're a nonprofit already, maybe what we could do is find a funding opportunity that we would all sign on, and say letters of support, right? And they would directly apply if they have the capacity and interest to do that.
Yeah. Right now, because it's Cheeky Charity and it's an LGBT-based organization, they're really not eligible for any federal funding mechanisms. So, and we haven't seen, David and I look all the time for state-based ones.
Or
And
foundation.
yeah, we actually haven't tried foundations for anything like this, but we have been looking for like the survey and data collection support. So yeah, we can add that to the list too. That's a good idea, Sora. Thank you.
Thanks.
Thank you, Sora. Thank you, Shannon. We have a few more minutes in the call. Don't see a new comment.
Sheila, a question. Do we have the next topic and presenter already identified?
Not yet. Sora, would you like to present?
Well, what I'd love to do is be able to actually ask all of the folks on the call whether there's anything that they would like to be able to present. I'll tell you right now, we just went through CCSG renewal. It was submitted yesterday. I'm not quite sure what we've got right now because it's like after spending a year writing a grant proposal, it's like I got to remember what the heck we're doing. Um, but if anyone's got anything particularly timely, I mean, this is such a mm, interesting time we're going through. I mean, I would love to hear, for example, on any headway going forward with HPV vaccination. I know we have a learning collaborative now, but I think we can learn a lot about what inroads people are making in this very difficult funding and communication time. So I'm just putting it out there. Um, I also know that, Stony does a lot of work working with our FQHCs and our counties and states, and I would be interested to know if any cancer centers are part of that, and if so, maybe they can help present to about things that they're doing that we could be learning about. So.
Great idea, Sarah. Thank you.
Stony, maybe you have an example of a cancer center that you would want to highlight as a best practice.
Oh, Stony, you're on mute.
I don't want to volunteer anyone, obviously, but Moore's Cancer Center is working with a lot of federally qualified health centers, but you are too, Sora. So there is one group that's Council of Community Clinics. They've got a new name now, but they got the large grant, and I haven't heard much more about that. And I'll look into that and see if they could do a presentation of what they're doing. They got the comprehensive CDC, grant, and I don't know how much it was this time or how long it's going to last. Used to be a 5-year grant, so we'll see. But I'll look into that. But
Yeah,
I can't volunteer anyone. I think, Sora, you're already
cool.
doing a lot with Cal Optima.
Yeah,
And
but I
y'all are working.
presented. Didn't I present last year?
You did.
Yeah.
So I would want someone else to be able to share what they're doing. I mean, Moore's would be fantastic.
Yeah,
They pres
I'll check with them.
they presented last year as
Oh,
well.
did they?
They
Okay.
did, yeah. We need another one.
Maybe.
All
Yeah,
right.
or I mean, if folks are interested in like clinical trials and all those kinds of things, maybe we could also be doing a joint one. Because I know one of the resource hub, like you said, Shante, was initially envisioned as to promote clinical trials, right? Collaboration. So maybe that would be a good thing to revisit. Yeah, I'm just brainstorming. I'm not volunteering anyone, but if anyone else has any other good ideas or things that are going well in your neck of the woods, please feel free to chime in. Thanks.
Appreciate it, Sora. All right. I don't see any other comments on the chat. Right. I think we can close a little bit early today. Thank you again for sharing your valuable time with us, and we look forward to your continuous collaboration. See you in April. Thanks, everyone.
Thanks, everyone.